So a big issue I find with a lot of population out there, no matter if you're an athlete, non-athlete, is plantar fasciitis. So plantar fasciitis is more or less pain on the bottom of your foot, okay? Can be as a result of many different issues, one being that the joints of your foot are not moving properly. Guess who's certified in extremities? This guy right here. So we want to make sure that those joints are moving as effectively. But also a secondary issue or a primary issue could be that the fascia, which is tissue that underlies the skin between the skin and the muscle and the joint, is irritated. And I relate fascia a lot of times to plastic wrap. So if you imagine plastic wrap that you cover food with, you stretch it out nice and straight, you crumble it up, what happens? It stays in that crumbled state. Fascia is very similar, that if it starts to crumble, it gets intertwined, it's very hard to kind of smooth it out again. So the purpose of these exercises are to help try to iron or smooth that fascia out. Fascia actually has a lot of nerve innervation to it, which is why it can be very painful. So I'm actually going to take my shoes off here. Lucky for you, you're not here, so you don't have to smell my lovely feet. But we're going to kind of bring the video down here so we can kind of highlight my foot. And I'm going to grab this little jacket here. So at home, you can actually use a jacket. You can use a bath towel for this exercise. We're going to place that towel or whatever you have at home on the ground. You're going to place your foot where you have a sock or you don't have a sock, but you don't want to have a shoe on here. And you're going to crunch up with your toes that towel or whatever you have. Now, because of the surface we have here, we're in a gym type matting, the towel is not moving that well. And that's okay. I just want to get that motion and some type of prop for you to try to focus on crunching your toes with. What that's effectively going to be doing is strengthening areas of your arch. So everyone knows they have an arch right in here. And another reason plantar fasciitis might be occurring is because you might have what's called fallen arches. Fallen arches is caused either because, again, the joints of the foot are not moving properly or they're abnormally positioned, or the muscles supporting those joints are not strong enough. This exercise is designed to strengthen up your arch. Regardless if your arch is quote unquote fallen or not, you still can strengthen up that muscle supporting that area, which can limit the amount of pain that you can have with plantar fasciitis type symptoms. So again, you're here, flat foot, crunching up that towel, whatever you have on the floor. To advance that, if you have any marbles, which I don't know if anyone, unless you have like kids at home, and I don't even know if kids play with marbles anymore, but if you have marbles at home, you can place marbles on the floor. So actually, let me get a little pebble, actually, that we have here in place of my marble. And we're going to see if this works. You're going to try to crunch up that pebble. It works. Okay, like that. And you can have a little bucket that you drop that pebble or marble into. That's going to be a little bit more advanced, again, to try to strengthen up that area of the arch. Take it a step forward throughout the day with your foot in your shoe. You can still kind of put pressure into the toe. See how we're making a little bit more of an archway? Hence why your arch is called your arch, okay? In through that region. That will help as well try to facilitate better strengthening in through that area, okay? So that's the strengthening process. Well, what do we do about trying to untangle the crunchiness of that fascia? So one thing you can do is self-massage. So you kind of get in here with your thumb and you do like a circular motion. It's not going to be the most fun. Just trying to break up some of those adhesions. You can get a water bottle, fill it up with water, throw it in your freezer, and you can roll your foot over top of that. That's also good. They do make special balls. Some of them have spikes, but you can also just use a tennis ball or lacrosse ball or something of that nature and roll the bottom of your foot over top of that ball. Not putting a lot of pressure on there, but just a little bit of pressure, trying to break that up. I also couple that with an ice massage. So I don't just throw an ice bag on there. I did mention the water bottle rolling that's frozen, that's good. But you can actually take like a Dixie cup, fill it up with water, put it in the freezer. Now you have a little handle around an ice cube, and you're going to do a nice little circular motion around that archway to try to alleviate some of the inflammation that's associated with plantar fasciitis. Fasciitis, itis in Latin means inflammation, so it's nothing more than inflammation of the fascia. So we have to take care of that inflammation via the exercises, the stretches, but also then with some ice massaging as well. Heat I generally try to avoid unless I'm going towards a competition, because heat is actually going to increase that inflammation. Yes, it's going to loosen up the fascia initially, but it will actually increase the inflammation at its initial onset. The other thing you want to make sure you're doing is stretching out your calf. So that's things like keeping a bent knee here and pushing your heel into the floor, okay? Coming up on either a staircase or something of that nature and coming forward like that, or even going down into like a push-up position, adding a little bit of pressure right there on top like that, stretching out your calf, because your calf muscle, okay, ties into your fascia. So your calf muscle comes down, runs through your heel, and then goes down into the bottom surface of your foot. This is all in addition to, of course, the care you're going to receive in the office via myself assessing the joints of the foot, but also doing any type of ancillary therapy such as ultrasound, stim, Groston technique, and things of that nature.